name is Brittany Harlow. I am the lead journalist at VNN Oklahoma. And today we are going to be talking a little bit about the financial crisis for mental health providers. So joining me today, if you guys wouldn't mind sharing your name and your official title for why you're here.
My name is Leslie Smith, and I am a licensed alcohol and drug counselor with a mental health emphasis. I currently have an agency called Be4Me, Counseling and Recovery. And but at this moment, I'm also working with my colleague here, Marjorie Ray, and I'll kind of let you introduce yourself.
Thank you. My name is Marjorie Ray. I am LPC, which is Licensed Professional Counselor. I have a background in education and have been a school counselor as well. So my agency is Hope Blooms LLC in Muskogee. I'm thankful to have Leslie as a part and her team.
Now, there's a lot to go through. I got some information basically about this catastrophe, for lack of a better word, that occurred on April 1st of this year, but it actually started a little ways earlier than that. And so I believe that, and I have some documentation here that was even about a managed care silent rally in response to what was basically as a result of this. But it is relating to the SoonerCare transitioned to managed care. And so for anyone who has no idea what's been going on, how can you explain that for someone and sure. Basically like how long has this been in the works?
All right. So, and some of these dates are just going to be,
rough.
A little rough.
All right.
But basically, let's say about 2 years ago, there was an initiative with the state of Oklahoma to take the Medicaid program that is intact now under OHCA, which is the Oklahoma Healthcare Authority. Oklahoma Healthcare Authority is the one that manages all of the providers' claims and payments and makes sure that we're following payment protocols and that type of thing. What happens with managed care is the state decided that there could be better services given to each patient that was eligible. And remember, this isn't just mental health. This is every service provider across the state of Oklahoma. So we're talking about doctors and podiatrists and dentists. Yeah, everybody that would bill Medicaid on behalf of a patient, OHCA. Okay. Mm-hmm. What they did was they decided to put out contracts, and these contractors are traditional, independent insurance companies. All right. And when the contracts came back, there were three basically that had won these awards, and one of them was Aetna, one of them was Humana, and one of them I want to say, forgive me if I pronounce it wrong, but it's Centene, but they go as Oklahoma Complete Health. So we kept getting notifications, this is going to happen, this is going to happen, this is going to happen. This is your date, April 1st, 2024.
And so for further clarification, these three companies are now going to be managing Medicaid claims?
Mm-hmm. Right.
They call the group MCO, which is Managed Care of Oklahoma. So we refer to those three as MCO.
Mm-hmm.
Okay, awesome. Okay. You got notifications that this big transition was going to be effective April 1st. Was it a smooth transition?
Absolutely not. Devastating. And, I'm trying to be reasonable in my opinions about, I can tell you how I think it happened, and I'm pretty sure it's accurate. In this transition, there was not good training, communication, preparedness from the state to agencies, providers, and patients. Okay? The campaign that they should have put out for that education purpose didn't happen. So up until the day of April first, we had so many questions. We didn't know what was going to happen. We knew how we paid and or how we submitted claims and how they were paid through OHCA, but we had no idea. It was like flying blind. We had no idea what was going to happen.
So basically, this is the lack of communication and education was relating like, okay, you have a new claims processing entity, and that is now going to be taking care of these Medicaid claims, and there was no real like transition or smooth transition into this new system for submitting claims, and that is how you get payment, correct?
Exactly.
Correct.
Exactly. And you know, there's contractors that are employees of agencies, and there are not contractors. There are people who are employees of agencies, but then there are people that are contractors of agencies. And a contractor, just for reference, means that me as a contractor, I have a private practice over here, but I have agreed because of my contract with OHCA that all of my billing, and especially adult Medicaid, will go through an agency. They are the oversight force for everybody that works within the system as a provider, okay? So we kept waiting for information, and in our particular situation, we have an EMR, an electronic medical reporting system that's connected to OHCA. For years, it's smooth, back and forth. We have reports that we can pull. We can see what's going on behind the scenes. We can go to OHCA and get information. But as this was coming up, they were telling us through little emails and things that we would get from the state that the client had to make a decision by March 15th on which provider they wanted. And letters had been sent out to all of them. But when we talked to our provider, I mean, not our providers, to our clients, when we talked to our clients were saying, we didn't get anything. We didn't get anything. We haven't seen anything. So after that date, we also weren't able to go into what we call our eligibility system that's on the SoonerCare portal. And the name of this process has gone from SoonerCare to SoonerSelect. Okay? That SoonerSelect is now the managed care. So what ends up happening is we can't get any information. We don't know who's going to be providing services to our clients. We don't know if some of them are going to stay with legacy Medicaid or if they're going to go to one of these three.
So this was not just something that you guys had to change. These were the people that were receiving the services also had to go in and make changes.
But if they didn't, they were assigned.
Okay.
So after this date of March 15th, they were assigned. Well, when the assignment took place then, we had hoped that on March 16th, we could go to our eligibility system because, mind you, they've had 2 years to develop this, right? 2 years. And so there was nothing there. We were still flying blind. Didn't know who was doing what. We also didn't know how we were supposed to bill. Do we bill through the state? Can our EMR do that? Can we do this process? Can we do this process? We went to a couple of the
town hall meetings.
Yeah, with the new insurance companies, but their focus was this, and rightly so. Okay, this is our company. We've agreed with the state that we'll pay everything that they will pay at the same rate that they will pay it. Business as usual. Your clients that have been transferred over, they're all going to receive a book. And which they did, the ones that were connected, they did receive that. And then, and we're just going to go forward. So just keep billing, keep going forward. Well, our EMR guy, his name is James Bearden, and he's with Chart Caddy. And I'm telling you, the work that he had to do to just prepare us so that we would know.
Now, to stop.
Yep.
I think that the Chart Caddy, I did see many of those emails of him just like getting what was happening and trying to digest it and put it out, and so amazing. I did see a lot of work. But even him, it seemed like he was experiencing a lot of issues and trying to get solutions, and they were falling on deaf ears. So it's kind of like everyone was still flying blind, but you had this kind of leader that was like, I will be the blind leading the blind and try to understand as much as possible to help people. And so that, even though it was not a lot of clarity and not a lot of back and forth with people who could actually fix the system, that it was beneficial on that level.
Exactly right. And he's the data guy, right? So he speaks the language that mental health therapists don't speak. He makes our job very easy, but think about all of the clients that he has that depends on his service. We're just one.
Yes.
Okay. And so across the state of Oklahoma, he has all of these providers, and some of them are different. Some of them are not necessarily mental health. Okay. But that they do. They charge Medicaid. So we were watching James. He's trying to be comforting, but at the same time, you can tell he's panicked. He can't get information. He can't, get the data sources that he needs. He hears rumors and he chases his rumors and he does this stuff. So the first report that we got from him was on March 1st. So on March 1st, he says, we don't know. It's still crickets out there. Nobody's talking. And so then the closer we get the 15th, he's going, oh my goodness. Wow. I don't know how you're going to verify the validation of who's on what plan or whatever. It's not appearing yet to where you have that. And then there was a lot of changes that he had to make, and there was a lot of provider information. So he doesn't know the sources out here, right? But what he's done now is done the investigation to go, oh, look, if this is going to work, I just realized not only do you have to go to the source that the state says you're going to use, which is Availity, and it's a pretty common source. Nobody knew how to navigate it.
It's like reverse investigation.
Absolutely.
Exactly. And so then he said, but I think for the data to work, what we're going to end up having to do is, Marjorie, you're going to have to go now and go directly to that person's website. You're going to have to identify yourself with them. You're going to have to fill out these particular, parameters. You're going to have to do the electronic funds transfer and the 835, because the information that would come to Chart Caddy, it's on Availity. We thought by doing that the way we were going to do, it would still come to Chart Caddy, and it wouldn't. So now, in order for Chart Caddy to get that information, then Marjorie had to go, well, who knew?
But yeah, exactly. So like you're having to figure this out when that's probably one of the things that you would expect to be explained to you.
Very much extra work.
We've been talking a lot about logistics and obviously, hiccups and processing. And so for people who, I feel like a lot of people that are in this, they know what's happening and they're like in the thick of it. But for people who should care, that like outside of that realm, like people that are impacted, whether that is them directly trying to get care, or even people in the future trying to get care, because obviously Oklahoma has a lot of health issues and challenges, and mental health is like one of the biggest ones, and especially it being mental health month. And I think that it's very timely to have this conversation, and honestly for these challenges, if any time, to be addressed. But for people who are watching this or learning more about this isn't just like a logistic problem for providers. So I have an email here from a gentleman named Clyde Wofford, and you had mentioned that this is okay to share as far as like these communications, just for the sake of getting them out there.
Sure.
But out of over 150 agencies, they've lost a total of 7 agencies that have gone out of business
quickly.
Over 100 user jobs is what it says.
Yes.
So for people who are thinking like, oh, well, that's devastating for people that are working in that industry, I hope they figure out how does that translate to the state of Oklahoma and people that are living here and needing care.
One quick thing, I want to refer you to the date that he wrote that. How many days after April 1st was that?
That's almost a month.
Okay.
It's towards the end of April, and even now this interview is, I don't know what day it is, but somewhere in the 14th. The kind of the mid-month area. And so this even was a few weeks ago of this communication. So
what happened? April 1st comes, we continue to bill. Normally, with the state of Oklahoma, whatever is uploaded into their system from each of the providers on Wednesday is paid the following Wednesday. That's the general rule of thumb, and it's pretty accurate.
It's been.
So we submitted our stuff the way we were supposed to, didn't know where it was going, didn't know where our payments were going to come from, but a week later, nothing. So we kept billing, and James suggested bill every day. We'll upload every night. We'll do whatever we can do to try to expedite this information to the providers. 2 weeks came, no pay. When was the very first deposit that you can remember getting?
The first paper checks, because they required that we first receive paper checks before we could set up electronic deposits. So that was another cramp because we have to go to the office, wait for the mailman, open the letters. The 17th of April was our first paper check.
Okay.
Wow.
Now, with OCA, Oklahoma Healthcare Authority, billing Wednesday morning, paying us on the following Wednesday, it cut our revenue more than half the first week. And we're moderate with 25 providers. For agencies who were much smaller, those are the ones that were lost immediately because they could not keep the lights on with 45% of their revenue for weeks.
Just like basically not getting paid anymore.
Therapists were not getting paid.
Even though we got paid, what was the next problem we discovered?
The issue with the payments were, when I received 14 letters in the mail, 4 were payments and 10 were either complete zeros or minuscule amounts. They said they would pay what OCA paid, but they didn't have our codes. The insurance companies are paying codes that they don't. Our units are 4 units per session, and they're paying 1 unit because they assume a session is a one thing. So the payments that did come were a quarter of what they should have been. So in addition to waiting for weeks and weeks, the payments were so small because they didn't understand our billing. The communication between the state and mental health was not there.
Now, I heard rumor or communication somewhere in all of these is that the state was going to do something. It's like kind of like, oh, we're so sorry that you're not getting paid at all, or you're not getting the money that you should be getting, and this is our fault. And so we're going to help you with some monetary compensation so that you can keep the lights on. Did that happen, or?
They made an offer. I received an email from the state, and then James put it in Chart Caddy for all the therapists that they would offer an advance. What did they call it? Advance payment. They would offer an advance. So I clicked the button just to see, because I had therapists who had not been paid for weeks. Aetna responded immediately. Oklahoma Complete Health responded immediately. They will provide funding to help us. It is due back to them on July 1st.
Can I say something about this? This is what people aren't thinking up here, okay? So if I tell you that I recognize that some of these claims aren't paying correctly, and we're working on it. We're going to get all of this straightened out. You're going to get every penny that's due you, but I have up to 90 days as an insurance company to be able to make all those corrections, okay? So there was money set aside, and apparently it was mandated by the contract with the state of Oklahoma to help in emergencies if it was not a smooth transition. So what I'm going to do is I'm going to offer you $10,000, okay? Out of that $10,000, I want you to start paying it back in 90 days or 60 days, whatever it is, 45 days.
Yeah, July 1st.
Okay. Here's the problem. You're billing 4 entities: Legacy, Medicaid, and 3 providers. We don't have a way to track what they have paid you other than by paper, who means that we have to now hire somebody in our office that spends their whole day saying, out of 25 people, this one belongs to this person, didn't 0. This one belongs to this person, a quarter of what they owed us.
So basically, it's your responsibility now to track what has been paid, what has not been paid through paper.
Right.
And also with the idea that they will submit all of this back pay also by July 1st, right? Because the idea is that they'll pay it now or that everything will get paid through this basically like advance, but you're going to be keeping track of it, and the idea is that they would remedy things.
Right.
To me,
the problem is if we pay providers who are struggling out of that money, how do I get that back on July 1st? If I pay Leslie, if she's struggling on July 1st, I've got to send, Hope Blooms has to send that back. But
so you're expecting them to pay correctly and that they will remedy all of their payment issues. And so that when that happens, that I guess the system is that you would pay back from that money, but you're not going to be able to pay back. Essentially, if they don't pay you your money, then you're going to be paying out of pocket somehow.
And we don't know where to put it. So Aetna, we would have to go 25 providers. Each one of them have a caseload of an average of 20. How many of their 20 for 25 people are on that insurance company? The state did not give us enough time. Not only did we not know how it would come to us, they did not give us enough time to develop our own internal systems to deal with it.
Or tell you the systems you'd have to develop, right? It sounds like there's been a really long, big learning curve that you guys have been responsible of. And so just for the sake of time, and we've gone over a lot of these, and there's still so much more obviously to talk about, but what needs to happen? I mean, and that's if you know, because that is like, what.
Well, let me say this. None of this is the insurance company's fault. All right. We have spoken with our representatives at a couple of these insurance companies. They're hearing the same thing from the people that they're trying to help. But at one point, there was a data dump from the state of Oklahoma that was archaic. It was irrelevant. The codes were not matching to what the state had said. They didn't even have representatives come in and help these insurance companies make sure. But if you need us, call us. Okay, that kind of thing. So at this point, what needs to happen is the state of Oklahoma, first of all, needs to be public and validate all of these providers across the state of Oklahoma that have either had to lose their jobs, that were under agencies that had to go under, that were with agencies that said, we're not doing any more of the Medicaid. What happened to the patients? This is a ripple effect. It's not here. The ripple has affected so many things, and until the state acknowledges it, and it would really be hard to just hear, yeah, we realize we made a few mistakes, but we're on task now. Now, there needs to be some kind of compensation back to these agencies, and especially the ones that closed. And there's not a central force that is collecting to say, we had this many agencies and we lost this many workers, and this many people quit those agencies because of. So I don't know the answer, but I know that there is a collective group of people out there that understand. They've felt the pain of exactly what and it's not over. It's still not over.
It's not been fixed.
No, I had to call creditors and say, student loans. How am I going to explain to them that the state of Oklahoma had a situation, and so there were things that I just had to prioritize.
And stop paying. Yeah, because again, that's your money, your livelihood.
And here's an example of the way it impacts our patients, medical and therapy. I have a grandmother of 8. She has 8 children in her home. And when she called me, she said, I am so stressed out. The children had dental appointments all at one place. They no longer take Medicaid. So now grandmother 8 is having to go to 3 or 4 different dentists to find someone who will take Medicaid, because the dentists, some of them said, like the medical, we can't bill for insurances, so we just won't take Medicaid.
Let me ask you this.
It's knocking out people who need the services.
That's true, because they did
the doctors, some of the, I live in Muskogee, some of them they've sworn off Medicaid.
But let me say something else too, that's just real quick. I heard this conversation the other day. The insurance companies say we are managing that for them, but it's no longer technically Medicaid. you're now with this insurance company.
Mm-hmm.
So the rules have changed in so many ways.
They have.
But so if I'm a patient and I call them, do I say I have managed care and you're the provider, or do I say I have Aetna? Or if I go to a clinic or an office or something, how do I present myself so that there's not confusion? And so that's just another question. That's just another aggravation that I can't answer.
And on the Medicaid note, so for people who hear about like Medicaid and like, oh well, I have this insurance, so that doesn't necessarily impact me. Who typically has Medicaid? Like who are those? Like, are they typically people that don't make as much money, or like who does Medicaid exist for?
All right. So there's, first of all, it's the elderly, aged, and blind. Those are traditionally, but not always, people who have a disability that are eligible for both, or for Medicaid and sometimes Medicaid and Medicare. All right. Then there's another group of people that a couple of years ago, Oklahoma opted to take the federal money that was available so we could expand. So now there's a Medicaid expansion. Mm-hmm. The Medicaid expansion allowed a lot of people to get insurance, and especially during the pandemic.
Mm-hmm.
Yeah.
Yes.
Okay. Are those lower income people?
They are. They are. They're struggling. And some of them are single moms with kids. There was a day, back in the day, where the mom wouldn't be able to be covered, but the kids would. And so, we begin to see a lot of progress with that. I don't know exactly what the qualifications are now for this other group, but those that were eligible, those are the ones that all went to the managed care, and are no longer on legacy. So,
is there any final thoughts that you wanted to convey as far as what this issue has meant for your organizations or the state?
All I can say is I have tremendous empathy. I know just from our situation, I mean, I contemplated just saying enough. You can only take so much stress. You can only watch your family suffer. You can only listen to so many people, and I will say this, especially in the mental health field, our therapists, our workers in the field, case managers, all of these people are so stressed just because we're coming out of the pandemic. The worldview is not real healthy right now.
No.
Okay. And if there was ever a time that mental health people also needed mental health,
yes,
it's us. Now the burden's on us to do self-care. Yes. And so some of us have gotten together to where we actually do self-help groups so that we can do exactly what we know to do. Okay. But it's devastating. This isn't just about money. Like I said, it ripples. Okay. It's going to take months and months for us to recover from this. And then hopefully we can get all of our providers back on a healthy track where they can take care of those
if they
that
fix
need
the
them.
issues. If they fix the coding and the billing and the issues, which are still not fixed.
They're not fixed yet. We keep seeing a little bit more hope. Like right now when we get a check, it's usually for this last current stuff, which feels a little better, with a few problems still. But I got a whole backload of money here that I need to get people paid.
That's right.
And that is stressful.
It's burdensome to have good workers who do the job and don't get paid. The first few weeks, it was horrendous for Leslie and I to see our people on payroll day with nothing almost.
Right.
Nothing.
And these are not wealthy people. Providers, I mean, this is their job. We love what we do, but,
doesn't pay great to begin with.
And the student loans don't care about MCO.
No.
They still want their payment. So we need help. We need help figuring it out.
All right. Well, thank you guys so much for speaking with me today. And hopefully everyone watching has a lot more insight as to what's been going on behind the scenes, and that it can, some solutions, and all of the solutions will come you guys' way very quickly.
Absolutely. Thank you for having us, and I hope it stirs a lot of conversation. So.
Thank you.